Hi
Three, two,
everyone, I'm
one.
Alexandra
Here we go.
Greenhill. I am a physician and I'm the CEO and Chief Medical Officer of Careteam, the virtual health collaboration platform. So, in the last 20 years of practice, I have been on the forefront of implementing the kind of innovation that has transformed our healthcare systems, from evidence-informed medicine to IHI to EMRs and EHRs and telehealth. And I have seen firsthand the impact of that innovation in real life. I also know, as many of you do, that we're not there yet, that there's much that we can do to fulfill the promise of digital health. And that's where Careteam comes in. We've used all of our knowledge to design it as a smart overlay that sits and fits on top of existing investments and leverages them so that we can quickly collaborate better between clinicians within the same organizations and across different groups, as well as include patients and community partners. And much more importantly, not just collaborate in a reactive mode or record what has happened, but be able to plan and ensure that the plan gets actioned and ensure that we can learn from every implementation so that we can do a better job the next time. So how Careteam was designed, it's an all-in-one solution. It allows you to do many different things for different users all on the same platform so that there's a true 360 view of the patient. For example, in the COVID crisis, we've been deployed to help organizations triage and manage suspected and confirmed cases at home, ensure that information is sent to them real time, and there's an overall analysis of trends, gaps, and overlaps to direct resources to where they're needed. All while virtual coordination of primary and specialty care can be done so that patients are clear on what should be happening before, during, and after a visit in order to use the resources the best and ensure that they are following the kind of instructions that they need to be following in order to maintain their health for the kind of conditions that cannot wait and are likely to get worse unless care continues for them, even within the pandemic. And last but not least, there's a side of our software that patients and families can use to implement all of this plan in real life, coordinate the things that need to happen within loved ones and support circles in the community in order for the patients to be able to deliver on the kind of instructions that they were given. The way Careteam works is that it recognizes that there's many different ways of delivering care, that sometimes you need to transfer care or manage in parallel or do shared care, but the same platform facilitates all of these variations and enables seamless transitions and adjustments. The fundamental structure of Careteam is that it needs to be easy to learn, recognize the different use cases and needs of every type of user, and it needs to be flexible. It needs to enable people to identify who's who on the healthcare team and on the patient side, what is their role relative to the action plan, be able to implement the care plan with appointments, tasks, and secure messaging, and then be able to monitor progress and identify patterns. This approach to chronic and complex healthcare conditions allows us to maximize what we do on the medical side, maximize what the patient and family can do, and recognize the importance of social determinants of health and better understand the data around where and what is missing in order to ensure that the patient can implement the care plans that we're giving them. There's a deep understanding of the clinical workflow and what clinicians and administrators need, as well as the patient and family workflow, all enabled within a healthcare-grade privacy enterprise software system, integration with existing other tools, and one of our innovations that is absolutely key to enable collaboration across organizations is that the sharing is enabled by privacy by patient, and you don't have to sign a BAA with every organization that you want to collaborate with. This allows us to create the kind of virtual care collaboration across the ecosystem that we have all identified as necessary and deliver better outcomes, better patient satisfaction, better clinician satisfaction, and better uses of our resources. Thank you, and I look forward to questions.
Fantastic. And I believe we've got Dr. Greenhill with us this morning. Dr. Greenhill, can you hear me? You on the line? We've
Yes,
got a number of
the
questions.
video is not showing.
No worries, we'll pull you up in a second. So we've actually had a number of questions in relation to EHR integration. So questions around, hey, does your solution eventually, is this collaboration with Cerner, Epic, etc., or is this eventually in competition? And another question around mobile patient applications. Could this be an add-on or otherwise?
I love the comments earlier from Charlie, because his experience is unfortunately things that I've heard patients have all over, and physicians as well. And so we designed Careteam to be sitting on top of other tools, so integrating into Epic and not duplicating what it does, but extending it into ways that the existing software just can't adapt fast enough. And his comments about patient use, we've seen also, it's not age dependent. If you build software that's intuitive and easy to use, any patient will adopt, or have someone in their household who can be the digital manager of their experience and ensure that the communication happens.
Fantastic. One really good question here around, could you just, like, in a short nugget, describe a case study or a particular use case from a patient's perspective?
Absolutely. We started with the most complex scenario of people living at home with dementia. And so our first organization to adopt was an acute care hospital that gave this at the end of the assessment with dementia, and enabled 22 community organizations and primary clinics to all come together and understand that patient who leaves that department, what happens next, whether they're referred to a dementia coach, community resources, they drop-in programs, is the family struggling or not? But without having to hire a number of nurses to do case management, enabling one or two nurses to use the software to guide and ensure the resources are there and people are participating well, but really extending the capacity of the clinicians to do what they were trained to do, instead of shuffling paperwork or transferring over e-files. And each family stepped in. About half of the users, the family member doesn't live in the same city, but is involved remotely in the care of the loved one.
And I suppose the asynchronous possibilities here are really important as well.
Absolutely.
Yeah. Got just to hop to the end here. We've got two questions around therapeutic area. Is this particularly TA-specific solutions, or could there be other therapeutic areas on the roadmap? And privacy by patient. I think you mentioned that along the way, that we've got one listener who Harvey Goodman would like to understand a little bit more about what that means. And just really short, because we'll have to land the plane.
Great questions. And so we use SOAP notes in healthcare as a format, and physicians use it, nurses use it in all kinds of settings, in all kinds of ways. And so we designed a software that is agnostic to the content, because there's often as much variability in practice within the condition than there's across a condition. And as a GP, my patients, the average patient has 7 health issues, and they're being asked to download an app for each one of them and for each organization that they use. That's just crazy. And so our tool sits on top and says, there's a certain number of things that need to happen. Who's who, what's the plan, what are the action items? And those can be very different, but similar across conditions. And the second question we had is, okay, we all agree we have to collaborate, but the BAA process and privacy and the tension that Charlie mentioned between comprehensiveness of data and privacy, how do you balance this out? Well, we said, well, easy, it's all about patient consent. If the patient consents and invites everyone to this neutral ground, which is Careteam, this works.
Yeah, it's a curious thing, and I knew it from healthcare, where patients often say, share my data, share it amongst my care team. And we're on the provider side saying, well, we can't, you know, we're worried about that. So look, thanks very much for the wonderful presentation, great answers, and we'll hop on to the next startup now. But thanks very much for being with us today.